Alright, this is actually a good vessel system. Okay. This big thing coming up is the internal carotid right here. The internal carotid comes up just like the stick is coming up right here and bifurcates. Okay? It branches off into this other big fat thing right here, which is your middle cerebral artery, which is one of the biggest arteries in the brain. Okay, middle cerebral artery is also the most common place for strokes, right? So, middle cerebral artery, then you come up around, and you've got two here, okay, two branches, anterior cerebral arteries, right? And then to make the lower half of the circle, this is not a good posterior, but we go to brain number 2. Okay, and what you're going to look for then is down here, you kind of got to look, there's two branches. The top one is going to be your posterior cerebral artery, and that's going in the back. And then this is actually a cerebellar artery. Okay, this should be one of the cerebellar arteries. There's usually two there. This is like, I think, the superior cerebellar artery or something like that. But it's going back there to feed the cerebellum as well. But you want to think about the circle, right? Anterior, middle, posterior. Okay, all coming off of the internal carotid. Okay, this big fat thing, which no one's going to get wrong, is the basilar, right? And the basilar bifurcates into two vertebral arteries. Okay, coming off the back of the basilar, probably this one, there's usually, I think, two branches, are more cerebellar arteries, right? Because you got to get blood to the cerebellum, right? The cerebellum, let's see, if you pick this up, the bump right around this area here is the tonsils. That's how I always remember. I told you, some of you guys, you pick up the brainstem, and there's your tonsils, right around this area. The middle part, we need a cerebellum, but the middle part, the connecting, kind of the equivalent of the corpus callosum in the cerebellum, is the vermis. Okay? That's the same, it's kind of like the connecting part. These are your cerebellar hemispheres. And then the flocculus is kind of like this area here, this kind of bumpy area. These are more cerebellar arteries, but probably like this bump, this area, it's kind of just like a section or an area of the hemispheres. Kind of like, you know, where some of the gyri, like the angular gyri, is within the inferior parietal. Same kind of construct with the cerebellar. So, but I'm only going to hold you to the floccular nodules, and then the other major structures are the vermis and the tonsils. Okay.
How would you pin the vermis? It's just right in between.
I'm gonna get a cerebellum.
Okay.
These are not. I wouldn't probably pin it. We have loose cerebelli. Is that what multiple cerebelli? So we have them there. So I would use that. I would separate and use a separate one. Okay.
Thank you.
Got it?